Now it's time for our sponsored perspective portion of the program, which is presented by Surescripts. For that, I'm pleased to announce Dr. Steve Miller, Senior Vice President and Chief Medical Officer at Express Scripts, and Tom Skelton, Chief Executive Officer of Surescripts. Over to you, Tom.
Good morning. Thanks to Bob and Rachel and the staff at the Hill for having us here. We certainly appreciate the opportunity, and thanks to all the guests also, particularly Congressman Mullen and Congresswoman Clark. Their work around the EPCS Act is obviously something that we consider a key piece of the puzzle moving forward here. Surescripts is the nation's leading clinical information network. Our job is to deliver information in the natural workflow for the physician at the point of care. That's the biggest thing that we do each and every day. We deliver what we call actionable intelligence. Last year, we delivered about 11 billion transactions, of which over 1 billion were electronic prescriptions, which is a key part of who we are and what we do. In addition to automating the prescribing process, though, it's important to help physicians get answers to the questions they need at the point of care. Answers to the questions of who else is seeing this patient? Are they adhering to scripts that I've given previously? The script that I'm about to write, how much is that going to cost my patient? All of these are relevant and important questions that make a big, big difference in what we're trying to do here, because the delivery of that information is a vital component of solving the opioid crisis that exists here today in America. The private sector has a lot of technology and a lot of opportunity to help enhance and improve information flow to ensure that providers make informed decisions at the point of care. We've got technology, for example, that can help today by making sure that a patient's prescription and visit history are displayed proactively to help eliminate doctor shopping in the opioid world. We've got the opportunity to make sure also that only authorized providers are able to deliver for a patient a script for a controlled substance. These are the types of things that technology is able to do today. Unfortunately, unlike you heard from some of the other folks on the panel, that technology is somewhat underutilized. As it stands today, if you have a script written for you, it's not a controlled substance, you've got a 90% likelihood that that's going to be digitized, it's going to be done electronically. If, however, it is a controlled substance, chances are that it's about 14% going to be done digitally. That's just not acceptable. Now, we've seen some great progress there. There was a mandate put through in New York last year, and we saw tremendous uptake there. Steve and I were talking backstage. It's now above 90% of those scripts, those controlled substance scripts in New York, are going electronically. That's fabulous progress, and we're really excited about the EPCS Act because we believe it can have the exact same type of impact on the country that the New York Act had on New York's e-prescribing situation. So we're very excited about that. Now, let me introduce to you my esteemed colleague here, Dr. Steve Miller. Steve is the Chief Medical Officer for Express Scripts. Express Scripts is a pharmacy benefit management services company, which is a real mouthful for a guy like me. They offer a tremendous number of services, including home delivery, claims processing. They have a specialty pharmacy arm, and they deliver medical and drug-based data analytics to help ensure that all of the intelligence that we're building up in the healthcare system is utilized appropriately. Steve is a renowned medical researcher, clinician, and administrator, and has dedicated a tremendous amount of his professional time to helping to ensure that we're dealing with this crisis effectively. So what he and I are going to chat about here for the next few minutes is a little bit about what he and Express Scripts are doing to help ensure that we do everything we can to eliminate the crisis we face today. So Steve, welcome. Thank you very much.
Thanks for having me.
So let's start with the first one here. Why is addressing the opioid epidemic important to you and important to Express Scripts?
Yeah, so you've already heard from everyone else. That is, we're losing about 60,000 people a year when it comes to opioid and heroin abuse. For every dollar we spend on an opioid, we actually spend $41 to obtain that opioid. So we're going to back surgeons, dentists, and others to get those prescriptions. And so the economic burden in the United States is enormous, and the burden on families and lives is spectacular. And so we have got to do something about this.
So from your standpoint, you do a lot of traveling. You and I have chatted about this. You travel across the country. I'm sure you see a lot of the challenges that exist in the system around this. Hopefully, you're also seeing some rays of sunshine, a little bit of hope peeking through, maybe indications that we're on the right track. What would you share with everybody to let them know? These are the things that I'm seeing that tell us we're starting to have an impact on this.
Yeah, so you've actually heard a little bit about this today. You've seen that all the states, including Missouri finally, have passed PDMPs, that is, prescription drug monitoring programs. We now have some states that actually have mandated electronic prescribing of controlled substances. New York's the leader in this. And if you think about what this did for banking, when you made it electronic, you eliminated enormous amounts of fraud and abuse, but you also, importantly, made it more convenient for consumers. Electronic prescribing of controlled substances will actually make it more convenient for patients, give them better access to the care they need, but will actually eliminate the fraud, waste, and abuse that we see. And so New York is leading the country, but there's several other states that are following this, and we're really excited that the federal government is starting to get into the act, because this could be the single biggest aspect that will change the use, because we'll have data. And what I mean by this is the following. Most of you don't realize that an enormous number of prescriptions for opioids are paid for by cash. That does not get into the systems. If the doctor's required to prescribe it electronically, you have full visibility to it. So I, as a clinician, can actually see if you've been to a dentist, a back surgeon, several other doctors, I can see which states you're actually filling it in. And so you can actually close this loophole. You can give better care to patients and actually eliminate much of the abuse.
Fabulous. So obviously, a lot of folks that are here or will watch this are focused on policy making. What insights would you share with them to help guide their efforts moving forward? You've given some great background there on some of the trends that you're seeing. What other insights would you share with them?
Yeah, so number one is we got to have electronic prescribing of controlled substances. Behind that, to make it really convenient for patients, you actually want electronic prior authorization. So if a patient hits a block, hits an edit, if the doctor can in real time actually get the prior authorization, it doesn't just help them in opioids, it helps them across all of healthcare. Things that don't work are the tamper-resistant forms of the opioids. Remember that if you ask 100 addicts, do you want the old stuff that's easy to crush or the new stuff that's hard to crush, 100% of the opioid addicts will tell you they'd prefer the old stuff. But that's the only data that we have that it actually makes it better. Because what happens is if it's hard to crush, you have to use a big needle to inject it. If you need a big needle to inject it, you actually have to share needles. And that's why we have an HIV and hepatitis crisis in Indiana, for instance. And so we want to have legislation that makes sense, that can move this forward quickly.
So as a clinician, obviously, there's been talk earlier in the session about getting information to the point of care, but also being cognizant of the fact that we don't want to overwhelm the doctors at the point of care. So what information would you like to see there as a clinician that you don't have there today, and how can that help?
Yeah, so the most important thing is actually want to see the history. That is, you want to see which prescriptions this patient has already not only been prescribed, but what they've filled. Because then I can make an intelligent decision about, do I need to use an opioid? Do I need to do alternative care for this patient? Do I need to get them into a holistic pain management program? Remember that the other problem that you're trying to serve is that 75% of people start on opioids that are sitting in their parents' or their grandparents' cabinets. And so you want to make sure that we're eliminating the vast majority. The other big thing that you can do, which we've recently implemented, is for patients new to opioids, we now allow their first fill to be only 7 days. We've now had this in place for several months. We give the doctors the opportunity to override this. Only 1.3% of the time have doctors asked to override this. We are giving too much narcotics right off the bat. We need to cut this out. And these tools will actually allow us to do this.
So, Steve, there's a lot of tools that are available that we talked about earlier. There's a lot going on across the country. Anything else that you see that you think we need to address the epidemic and really at the same time provide the treatment to the patients that really need it?
Yeah, so one of the great things we've been able to do with this data is we've been able to create predictive models where I can predict if someone's going to be addicted to opioids before they get their first prescription. So we actually recently did a pilot with 106,000 people. They were at high predictive value. For 50,000 of them, we sent them just a generic letter. The other 50,000, we sent them a letter that said, we see you've been prescribed an opioid. Please be aware these are highly addicting. Work with your doctor to use ice or nonsteroidals or other things, and please dispose of what's left over properly. The likelihood of the patient going on to getting a second prescription went down by 20% with just a 44-cent letter. So the reality is, if we can get this data into the doctor's office where they also knew that their patient was at high risk, it may change their prescribing pattern. So there's lots of great things that could happen when you have transparency to the data in the future.
Well, Steve, thank you very much. Appreciate the insights, and thank you to the Hill for having us here today.